morning, Good morning, everybody. As Mercedes said, I'm Kathy Tambrello. I am parent to a 40-year-old who lives in a provider managed setting. So needless to say, this is all very important to me, as it is to all of you. We had a number of issues that we brought up under state government that I think also fall into provider managed settings. So I'll start by just saying that a couple things really hit me. Communication at all levels is critical to the safety and well-being of our loved ones. And that means from the state government, that means from the administration of the agency, the manager, to the DSPs, to the families. And with that, I'll just open it up. And I think your comments are so valuable. And you can see here on the screen, we have provider agencies. Their roles and responsibilities are obviously to provide direct individualized care, ensure safety, health, and community engagement, and ensure a high quality of life. So with that, I'll open it up to comments. No comments? I see Kathy Freeman's hand up.
I was going to say this in the previous section, but it goes just as well here when we talk about families and retaliation. Um, it's often very subtle, and what I see too when I mention consents and what I hear from the state is the state often says, we have a fee for service system. You can go elsewhere. Like these problems aren't elsewhere. So the fact that providers can use, say, criteria for discharge, uh, seeking compliance and also trying to minimize the verbalization of concerns really is a way of retaliation and trying to force a parent out of a particular provider. So the state saying that, you can just go elsewhere is really not very, it doesn't give families any kind of confidence if the provider has as much power as they do to even require the parent waive civil and human rights. I had a parent that lost a child, and when she sought that investigation of her death, um, she, she was told by the state employee that we can see that you often complained about the care that was given. And I knew this mother because she did say, I worry about my son dying. And he did. And the response from the state was, well, if you had so many problems with this provider, why didn't you change providers? Well, in her opinion, in the opinion of many people, that they were one of the better providers. So quite frankly, I'm hitting on a lot of things as far as the disclosure of information and also to this answer that we can go anywhere when, when we talk about reassuring the public. I mean, that is what the Department of Health does. One of their missions is to ensure public safety. And the fact that DHS acts independently without the same guardrails, as we call it, that the Department of Health has, that ensures licensing of physicians, of nurses, certification of home health aides, and CNAs, and medication aides. We don't have any of that. And why is that? Are we any less of a population to be served? So, no, we can't just go anywhere. Fee for service, as it was described to me when they said you can go somewhere else, made it seem like, that's your prerogative. That's why we built competition. Well, when providers can do whatever they feel they can do and they can break state and federal laws, then what assurance do we have from the state that are level that they're assuring any kind of safety nets as they do with Department of Health?
I think you bring up a good point, Kathy, and I think one of the challenges with that statement, you can go anywhere, is there is not enough openings and places to look that you would be able to find a better environment. And I think that puts fear into families that they need to stay where they are because at least they have a place.
Yep, and the devil you know is the sometimes the devil you don't.
I know, but I think you bring up a good point, and I think
And it's retaliation to say constant frivolous concerns that are unfound to be unfounded is a criteria for discharge. Well, again, the provider is using their opinion. It's very subjective, what they consider frivolous. And if it's unfounded, again, it's their assessment that it was unfounded. We actually have no safety nets.
yeah, I think too, there's a issue of communication there, that, has the family been able and has the agency listened to what's important to the family, how things need to be done for an individual. And as Paul said in the last session, are they using the family as a collaborative part of the team so that the information that the family gives is needed, it's valued, and
Yes, Kathy, but you know what? Some of us that are more involved, that express what our child needs, in comparison to, sadly, the majority of many of these individuals who have no one visiting, who have no one to advocate them, that we're the ones that they prefer not to serve. And so these are, again, a way of pushing you somewhere else. So they could fill that bed with someone, maybe a family that doesn't advocate. And if we're looking at the abuse and neglect that's going on, I have to say in my heart of hearts, how is this happening? Well, sadly, maybe there aren't families like us who are coming to these meetings and crying for help.
well, it's true. I think we have to look at safeguards for all, whether a family is in there advocating or not. I see Laura's hand up. Is Laura next, Kyoko? Hi, Laura.
Hi, everyone. Um, so I have a couple of things I wanted to add to this, but I think before I also had one, I think it's a conceptual recommendation. And I'll be honest, I'm not exactly sure how we would make it happen. But having, again, my son's been in with several different agencies since he was 18. And one of the things that in my personal experience is a big difference is whether or not a provider is a business, a corporation, or whether they're a nonprofit. They're both doing the same thing. They're both, earning money from the government. They're both providing care. But when there is a profit incentive in the corporations where, potentially their leadership, their shareholders are taking that profit at the end of the day, um, there's often a different mindset at the leadership level. And that is more about how do they save money because in the end of the day, that's meaningful to them or their shareholders, where most nonprofits are more invested in having to turn that money back into their agency, their home with more programming. Because again, they have no financial benefit from being they don't want to waste money and they still have budgets, but again, they're not incentivized personally at the leadership level to do that. And again, I think, we don't have a system of that in the state. Clearly, in other areas, nursing homes, hospitals are also businesses. And it doesn't mean that a business can't be well run and can't provide good care. But maybe there's a level of thought that goes into new agencies and how they're set up, or different roles, or, some, I don't know. I think they should be looked at differently in some way. That's just something I wanted to add because I don't think people think about it very often. On the actual slides, we've had a lot of conversation in the earlier session, and I'm sure in later sessions, about communication, transparency, and I think everyone agrees. But one of the things that I have just seen, I spend a lot of time with my son at his home, is just communication between staff, between shifts. You have, in a hospital setting, you have nurses. Nurses add notes to a chart. Another new nurse comes on, there's a handover procedure. And care is it's not perfect in the hospitals either, for those of us who spent a lot of time in them. But again, there's at least a system in place to try to communicate important aspects of day-to-day care. In group homes, there isn't a process. Now, maybe this is set up by the agency, and some agencies do it differently. But I've frequently seen where a staff will be like, I don't know who's on the afternoon shift. I haven't communicated. If I say, hey, there's something too important to communicate, maybe your kid is sick and hey, they need to have their fever checked. Somebody who's, oh, okay, we've noticed he has a fever, or somebody's identified it. And on that shift, someone is responsible, somebody's been identified. But who handles telling that next shift what to do, or what the issues are, or somebody was sick or not feeling well, or whatever the situation is? There's often not the same sort of charting system that, nurses have, or hospitals have, or nursing homes often have. And again, I think it's partly technology, but I think it's also on agencies to find ways that people can communicate across a period of time, because each shift does something different. Those people react differently, and there's often not consistent communication.
I think that's a really good point, Laura. And if it's left to variation between agencies on how that is done, that leaves op an opening for miscommunication. So I think that that is definitely a point worth um, going forward with. Um,
There,
I'll just read a comment on your comment that's in the chat. In the group homes, there's supposed to be a critical log so that daily staff is aware of things that need to be known and communicated amongst all staff working with the individual. So who's overseeing that and who's making sure that that happens, I think is important, and probably varies from agency to agency. Um, Kyoko, I think.
Yes. Next is Ronnie Del Vecchio and then Pat Miller.
Okay.
I just wanted to comment briefly. I know someone spoke beforehand about how intimidating it could be also in a lot of these agencies. We've also had an experience with that where with my son's high acuity behavioral challenges, we were told after trying to communicate, I know you mentioned that, Kathy, about communicating and how you communicate, which is, I agree, is very important. But it also depends on the agency and who's running it, right from the top, because literally we were asked to come to a meeting, and this is with second level in command leadership. So everyone right below the executive director was with us, called us to the meeting, and in no uncertain terms told my husband and I, well, you're going to have to put up with the way things are, because no one else is going to take your son. And I remember that clearly. And my husband and I looked at each other, and I said, "This is what you called us in for?" And yes. So we are doing what we can, but you are going to have to just deal with the way things are, because we know for a fact no one else will take your son. That is when my husband and I, before we made it to the car, decided to try self-directive, which was pretty tough with high acuity. But Sometimes, I've met many parents, as all of us have, in our, journeys with different providers. And many parents, I feel, they're tired. Uh, they they're tired. They're worried. They feel, yes, I can't get better, or I've done the best I could, and therefore that's it. And then later on, they pass on, and there is no one to advocate for these individuals. So, in looking at all these needed reforms, I always have to think about all the people, all the residences that my son was in, and those that were left behind that continually do not have a voice. Um, and I think this is very, it's very important that we are very clear about. Someone had mentioned before, we should have some kind of consequence for who's running it, the executive branch. Um, I think that's important. I think, but I think also there has maybe, how I know this just came out of my head, and I'm sure people will disagree. When people are going through a divorce, sometimes they get a mediator because they don't want to spend the money to go into, unless you have the money to go and lawyer up. And maybe there should be some type of an outside entity that mediates, and at the same time is also taking notes of what has been going on, what has been addressed, how it's been addressed, or how it hasn't been addressed, and also the consequences. There has to be consequences. Without really impactful consequences, not consequences that they could pay out and get a lawyer and go on, but real consequences where the voice of a parent or guardian carries equal weight and power. Because right now, we don't have that. We are the ones that are being manipulated or bullied, as are our loved ones. And I think that until we come out with needed reforms where we have equal footing, yes, we can go somewhere else. Well, try telling that to a parent that has a child or an adult with really difficult challenges, behavioral challenges, medical challenges. And for them to use that against you right away, there should be consequences just for speaking to a parent or a loved one like that. Well, thank you for your time.
Thank you, Rami. Those are very valid comments. Kyoko?
Next is Pat Miller, then Yana Marmel, and Mike Sullivan.
Okay, Pat.
Oops, can you hear me? Oh,
Yep.
sorry about that. Thank you. I mean, I agree with everything that Kathy and Romy just said. I mean, I think the really difficult piece to this is that it is such a broken system the way it currently is, right? I mean, families, the relationship between families and providers, the culture, I'm not sure how it got here, but it is terrible in that families are not being seen as the experts of their children. They're not seen as partners. They're not collaborative in any of the decision making that directly affects their loved ones. And unfortunately, because there's such a need for providers, providers can give substandard care, and families are accepting of it because there's real fear of retaliation, real fear of where else are they going to go, real exhaustion as we age, especially for those with high acuities. And so, I hate to beat a dead horse, but what I said in the last one is that we really have to look at providers who are doing this well and understand how to make systematic changes across the board so that those guidelines are not left open to interpretation, where there is such variability, not just between providers, but between homes, between managers, between DSPs, because that's what's happening is the risk just increases with that variability. And so, from the prevention standpoint, this person had run nursing homes for over 25 years and said, when you look at the guidelines for nursing homes, they're very specific. There's specific transparency, there's specific accountability, there's specific consequences for things not being done, and there's oversight. The same has to happen here. I mean, right now, because there's such a need for providers, there's such openness for, subpar care. And I think that that's really what has to change. And I know that that will mean some closures of providers, but I know as a parent of someone who has a profound and severe child, I'd rather have less with good quality than more, because right now, just like the previous person just stated, we're pulling our kids out and we're trying to do it at home because there's not a consistent care there. And so, I think this whole transparency about the financials from providers is a must, because the fee for service were funds to be used for the person intended. And right now, we have no idea where those funds are being spent. Nonprofit, profit, it doesn't matter. Okay. What we need to understand is that the dollars that have been accounted for to take care of this person are actually being utilized in the best way possible to care for that person, given their needs, whatever they may be, given their acuities, whatever they may be. But right now, we have a system, does whatever they want, does not have people in these positions that are given the training, given the tools, given the supervision, giving the mentoring to be able to even be successful, opening up that risk. And then you talk about management or supervision that's non-existent. No wonder only 2% of the cases that are being, reported are even investigated, because there's no enforcement, there's no reason to do so, because there's such a need, and that they understand that this can be, you can get away with this. And no other state-run funded agency would this be allowed.
Thank you, Pat. One of the things that you've said more than once today that I just would like to highlight, I think looking at the agencies that are doing it really well, and why are they doing it well, and what are the systems that they have in place, and how can those systems be replicated? I think, that's critical. Maybe we don't need to reinvent the wheel. Maybe there are models to look at that will help, so make sure that things are being done well. Thank you. Kyoko?
Next is Yana Marmel.
Okay.
Okay, thank you. Can you hear me?
Yes, we hear you.
Oh, okay, great. Thank you. So much to say, but I'd like to pivot. I think what's important is also to recognize that it's a partnership. And I see this in our current placement. The families understandably are sort of on the defensive, right? They've been through so much, and it's so hard to find a good placement, and they've been worn down, so to speak, right? So when an agency is looking for that kind of engagement, I sadly see that there is no partnership, but also coming from the families. Do you know what I'm saying? They are oftentimes very much on guard and distrustful. And look, we've spent a long time this morning already discussing the reasons why, and I'm the first person to be in that camp. However, I think it's so important to forge that partnership, right? Because it's very nearsighted to assume a position of this is them and this is us, right? And I know this is easier said than done, but I would encourage families to do this, especially when they see that the agency is trying their best. That's first thing. Secondly, I would say, when I hear a word blueprint, for example, when it pertains to architecture, right, building a house, the specs are so specific, right? Specifications. We need to get really granular as to the guidelines on how this care is to be to be performed, right? So just give you an example. the temperature inside a house. To my knowledge, there is no state guidance on what that temperature numerically should be. Is it 70 degrees? Is it 69? Is it 75? Is it 80? So, but I think we need to get to a point where most of the things that go into the care of individuals served are spelled out. And if they're not being adhered to, then there are consequences, et cetera, et cetera, et cetera. I also would like to add that much like, when we parent our kids, families with multiple children, the best way to sort of incentivize good behavior, obviously, is not just penalties, right? How do we reach a point where we reward the good players, right? It's because certainly, and we've covered this in the duration of this call already, there are good players. So how do we distinguish them from the rest? I think that will help things along. And I have some just specific points to the blueprint, roles and responsibilities, provide individualized direct care to all DD tiers. And again, I mentioned this in the earlier segment, if a provider claims to be tier EA, it must not discriminate against some EAs, right? Like this person is just too needy. They're too difficult to care for. I won't name this provider, but this provider has been highlighted as one of the best in our state. And I'm here to tell you, my suspicion is that because they stay away from difficult cases, it's much easier not to fall into the, sort of like this label of being a provider who has a high rate of abuse and neglect if you take the easier cases. Next, ensure safety, health, and community engagement. Again, too vague, needs to be defined, and I understand this is why we're having this conversation. Ensure a high quality of life, too ambiguous, and again, needs to be defined to be implemented. Needed reforms. Accountability, oversight, transparency. I'm so sorry, I was on the wrong one. Okay, so roles and responsibilities, provide individualized direct care. For example, cutting toenails. I could tell you most agencies will not cut toenails. Well, that's care. How do you address that? This must be defined and as detailed as possible. Ensure safety, health, and community engagement. Again, how? Medical health, mental health. What if an individual expresses that they don't want to go out into the community? And this happens often, right? When we see it's a double-edged sword of preserving somebody's rights, right? Under this banner of, well, this is the individual served right not to want to go out, that could be misused. I'll be honest with you. If somebody continuously is not going out into community, we need to see why not. But again, who is monitoring this and who is enforcing it? Here you have support and training for management positions. Again, by whom? Who provides the training? So I think it's very complex, but I also think that we can't just look at the negatives. We need to see how we could incentivize the good actors, not necessarily just focus on the bad actors. Thank you.
Thank you.
Kathy, if I could just add that's a good point that Yana made, and I'm not sure that we elaborated well enough, that if there are good practices, if there are things that are working, one of the objectives here is to, memorialize that, understand what's working well in an organization and see how that can be replicated across organizations. So I'm glad Yana raised it because I'm not sure that we highlighted it enough. And we may not have time today to get through some of the good practices that people feel. Let me just take this one. We may not have time today to get through the best practices, but we would encourage you to continue using the tools available to communicate that with us. But Kathy, before we move on, there is something in the chat, not in the cat, in the chat that I was asked to read by Linda Thomas. Provider agencies are able to keep monies from the individual budget if they cheapen the services. They have no guardrails at all in terms of how much money they can keep. And to that point, in April of 2024, the access rule was passed at the federal level, which would require at some point, if it remains in effect, that providers would have a responsibility to have 80% of funds go to the direct care. of services. So that might change at the federal level, but to Linda's point, yes, there are no guardrails in terms of transparency in funding for providers. Um, Sorry, I didn't mean to hijack things, but I think Kyoko will keep us back on track.
Well, I just wanted to make one comment if I could, based on what your Mel just said. Talking about staying away from those with high acuities, we also have to be very careful that some agencies are not taking purposely individuals with the higher budgets and but not providing the services that those high budgets are indicating that they need. And then just the other comment I have, because I think she made so many good points, um, was that you know we want all agencies to take a person-centered approach so that, yes, there might be an individual who doesn't enjoy an activity in the community. They should not be doing that, but we should be looking at what each person, um, what is meaningful to each person for a good quality of life. And the other thing I'll just say is a lot of what happens in the house has to do with the culture of how the house is run. And is it a supportive culture? Is there a house manager that understands how to work with people that report to her or him and provide that supportive culture and problem solve together, also in collaboration with the families? Those are just my couple of comments. Kyoko?
Yes. Next speaker is Mike Sullivan, followed by Melinda Inaron, Kate DeLuca, and Vincent Giordina.
Okay, Mike.
Hi. My son's been in a group home about 2 years, and I want to jump off what Laura had said about issues with handover from one staff to the next, from shift to shift. Our experience is there's many times where somebody will notice some problem, and somebody says, "Oh, it wasn't on my shift," and they have no idea when this issue came up. And so my additional point beyond what Laura said is, I think it'd be great if there was actually a physical sort of like inspection, that's probably not the right way to say it, of the each client from shift to shift so that nobody can say they didn't notice it. So we had an incident where my son, I mean, it was at night, so they probably would have to just crack the door open to see that everything's fine. But my son had a cut on his toe, and the the new shift came on, and she noticed there was like blood on the floor, and she patched him up and such, and she called the other shift worker, and she knew nothing about it. So I think, to elaborate on some of the points people are making, is to us it seems like the frontline staff are very good and caring in our home for the most part, but the it's not so much the group home manager, because a lot of things fall on her, but it's more like the organization supporting the staff in terms of like policies, procedures, and such like that. Of our problem is Another one of our problems, kind of related to agency oversight of the group home, is we've had so many instances of really terrible food handling in this place he's at, and we harp on it, and they just think we're complaining. Some of the frontline staff just thought we were like complaining. Some examples were um, defrosting chicken on the counter for hours, and you can't do that. The other is spoiled food in the refrigerator. The other was recently we pick up our son a couple times or once a week to take him to a speech, and we usually look at what he had for lunch. I opened up the fruit, and it was bad melon, which he ate. It smelled like vinegar. So it's I think in some cases maybe the staff don't know any better, but they get food training. But it's just there isn't oversight. Granted, you can get training, but I think the agency needs more to have more oversight on the staff to see that they're kind of complying with this training. Thank you.
Kyoko.
Next is Melinda Inanaron.
Thank you so much, Kyoko, and hi, thank you so much, Kathy. My name's Melinda. I have a kind of a unique experience in being here. I am the sibling to two women with special needs. One of them still lives at home with my mom. The other is in a provider managed setting, and I also have the privilege of being a leader at one of a provider managed setting in Morris County. And I think one of the pieces that, I had wanted to speak about, but Pat and Kathy and Mercedes and Yana had really hit on it as well, is that, not all providers are bad. There are providers who are not doing a good job and need to be held accountable for that. But there are providers who truly want to partner with families, who want to lead their programs in being community based and inclusive and person centered. And the piece that struck me, especially because my sister-in-law is a tier EA, and she has a very particular set of needs that at the agency I work for, we would not be able to meet. And, having to kind of just piggyback off of that conversation and being realistic, that I think it is important for providers to be realistic in whether or not they truly can support individuals that have high acute needs. And I also think that something at the provider that I work for that we're doing well is we acknowledge that the prevailing need is high acute individuals. And we are constantly thinking about how we can partner with the state as well as with the community, and particularly families, to develop programs that meet that need. And I think that that's a really important conversation and piece here is we have an intake and family services unit, and our leadership team from our CEO to our director of intake meet every week. And we talk about the need that we're seeing on the ground level and how we can make a difference to be able to meet that need. And I think that those are conversations that are important, or if there are conversations that are important for families to know that are being had amongst providers, because we know that the need is high acute. We know that, that the need has changed from what it would be 10, 20, 30, 40, 50 years ago. And I do think that the piece that for me, it's really important to highlight, again, coming from that unique dual role, is that partnership with families is really important. And there are providers and leaders who care about that, because how we run programs where I am, because I'm not the only one that's a sibling in leadership, our CEO and our CEO have that familial connection as well. As we run programs of where would I want my sister to live? What would I want the group home to look like that she lives in? What would the activities be at the day program if I had that opportunity, and I luckily do, to create them. And I think that that's really important. And just to touch off of the piece, Kathy, that you had mentioned, you talked about culture of a program. And I think that that's really important, a specific program. But I also think the culture of the agency as a whole also truly impacts how each of those very individualized programs are going to run as well. And that's something that as a state, as families, as providers, that I think needs to be a larger part of the conversation, and something that we talk about at our leadership level often.
Thank you, Melinda. Those are all excellent points. And I think you're very right. It's not only the culture of the house manager, but it's the culture of the agency from top to bottom. I'm just going to point out, Kyoko, that Romi's hand is raised through the chat. And who's up next?
Next is Kate DeLuca, excuse me, followed by Vincent Radia, Romy, and Pat.
Okay, great. Kate.
Hi. The first thing I wanted to start off with is something I'm just realizing is missing overall from the blueprint, is the support coordination element. I do think that it would be worthwhile to incorporate a section about challenges that support coordinators are facing as well, because they would be an integral part of like this whole process. Specifically going to the provider agency things, one thing that I want to highlight, I don't think it's quite spoken to in the reform section, but provider proactiveness. So for like, specifically what I'm thinking about, and with the realization that like we don't necessarily want to implement things that are onerous or impossible to fulfill. But right now, our current agency there are no less than 12 different people I am directed to contact for specific issues, and it's not just one contact event necessarily. So if I want to know subject X, I'm being routed towards this person, and it requires multiple follow-ups. And when you have like that kind of specialization, it's really putting a lot on families. And the agency is able to maintain, oh, well, all they had to do was ask. Well, sometimes we don't know the questions to ask. We've certainly encountered situations that we never would have even thought imaginable. But also, I just feel that it's making it unnecessarily difficult to get very basic information, and that in itself sometimes can be a way to discourage families from seeking information. A point that I don't see on the needed reforms list at all, and there has been some conversation going on in the chat about this, is related to documentation. So overall, kind of an evaluation of what is and isn't needed, because my understanding, and this is speaking as somebody who is not frontline staff, um, is that there is so much documentation that a lot of times, like frontline staff, is spending as much, if not more time completing that than actually interacting with or caring for the individual. So maybe an evaluation of like what should be documented, like how to do that, but also assessment of what the best forum is for doing that. Electronic, like, what are the criteria for electronic? Who can access this? Paper, like, how do you document? Like, like what are the elements of documentation? So things like that. I also wanted to say too that I think that the concept of privacy needs to be evaluated, an individual choice. And I don't mean this in a detrimental way. It's just that we all know that disability is not one thing. That's why like there's such a focus on person-centered planning. But somebody who may not like have the capacity to consent to things, it's different from somebody who has awareness that does. And I think a lot of times, like elements of privacy, for example, somebody with a seizure disorder that they can't alert to, and staff is not necessarily paying attention, to notice, like, cameras can be like declined to monitor for seizures because it's a privacy invasion. So like kind of like just thinking about what privacy means and how that sometimes is used to the detriment of the individuals being served. The last 2 points I just want to hit on related to this is also talking about training, and I think this was also referenced in the chat as well, but training not just necessarily being a signature on a piece of paper saying that something was done. What is training? How much of it is hands-on? Because it's very different than click-through modules, where somebody can just do something versus actual, I think that providing like structured guidelines of like, okay, what is involved in training, would be helpful. And lastly, kind of speaking to the point that has already been raised a couple times about culture coming from the top down, I think a mechanism for leadership evaluations, not leadership evaluating their staff, but staff like interacting like with their leadership and collecting that as a metric as well, as part of the way to hold leadership accountable and also as an opportunity for improvement.
Thank you, Kate. I will comment that the DSP training is being revised at this point by the Bog Center, and I think some of those elements are really important to consider. Kyoko.
Next is Vincent.
Okay.
Thank you. Several excellent points that have been made. I just want to second and add a little bit. First, the support coordinators, I think that's important to take a close look at, because they have essentially replaced what used to be case managers, which I was one when I first started with the state. But the support coordinators no longer have the power of the state behind them. There are different agencies that are trying to like get what would be a lot easier for a state case manager to once get and do. So I think that should be looked at. I really like the idea of looking at agencies that are doing well and what are they doing. One way to do that is to look at the report card, the state report card. And for me, the agencies that have cameras that are still getting high marks, I'm very interested in like, what are they doing right? Because they're showing their cards. So like, what is it? How are they doing so well? How are they getting all the green stars? I think that should be looked at closely. And what is it that is different about those agencies? Um, I think training is for the DSPs is often too overwhelming and too complicated. And like throwing these complicated policies that have been written by attorneys, and it's like, okay, now you must follow this. I don't think that that's working. I think the training should be designed to provide the DSPs with what are like the 10 most important things you should remember, or tailor it to the person who's receiving the training so that it will be remembered and not just an overwhelming thing that you're just signing off on an online training or something. um, and pay for staff. And this comes to the idea of how is money being spent at an agency. And I really like the idea of like 80% being spent on staff, because I mean the DSPs and the managers and the frontline staff at the agencies, from what I've seen, they're typically making like half or less than half than what people who are working in New Jersey at the state facilities are making doing the same jobs. So, for example, if you compare what a DSP is making versus a resident living specialist at the state, they're doing the same work, but a resident living specialist has a lot more benefits, a lot more salary. Like, I mean, why is that? Why have we privatized this service and then we're paying the people doing it less than half of what they were doing at the state? That doesn't make a lot of sense to me. Um, and I really like the idea of like that. I guess sometimes they call it 360 evaluation, like evaluating leadership and that being available for outside of the agency. It's like, well, how are like right now, the only way you can sometimes get a glimpse of that is like to look on like Glassdoor or Indeed. It's like, well, what are people who have worked at these agencies actually saying about the leadership? But I think that should be more of I agree that should be more of a formalized process. And just lastly, in terms of the idea of privacy and cameras, I think there's always an exception to the rule, and there can always be, if people are able to consent or their families say no, we don't want cameras. There's a way to make that happen within an agency, but even if the rule is yes, cameras are part of the deal, and they're in our homes and residences and day programs. But if you don't want that, we can work something out, and with a waiver that you're not going to have the protections that a camera can provide. Thank you.
Thank you. Those are all good comments. Kyoko.
Ronnie Delvecchio is next, and Patricia Miller.
Okay.
Hi, just call me Romy. I know it's a hard name, a hard last name. Really good points brought up. I just have one quick thing. I was listening to Melinda's points, and that is very important to see what the agency is going for. Agencies that I have that I'm currently dealing with, I think it's important to also know what the background of that executive director would be in an agency. Do they understand acuity? Do they understand the people that the agency is serving? Do they understand families in crisis? And the reason I say that is because we try to put people at the helm that know about the business, and we don't do that here. In two other agencies that my son has been in with really difficult outcomes, it had to do also with who was at the helm, because when you have issues, you honor the who is next to speak to, right, for leadership. And then when you get to the top and you feel that you're really not being heard, that's when you get really discouraged. But again, it really would help if the person that is making these decisions or is leading the mission statement or making a new mission statement, that they understand the variety of the people that we are servicing, and that understands families, especially families that are in crisis. I think that's important. Another case, yes, I love cameras. Many families I speak to like the idea of cameras again, and sometimes a way to bypass people that parents that don't want it or guardians that don't want it. Sometimes they just don't want it in the bedroom, which is totally understandable. But again, another important question to ask besides knowing that the agency does have cameras is who is looking, who is monitoring these cameras, and how are they reporting what they see? So that's important. One last thing. Yes, support coordination. Yes, it's a real big difference. Vincent made that. That's really important, Vincent. Thank you. Support coordination is very difficult, especially now that everyone is transitioning to, well, I can't even say the word, and I hear it all the time. It begins with an A, acumen, from public partnerships and Easter seals. And it's very difficult because support coordinators don't have the same power, and they're a private entity. And a lot of them really lack a lot of training in individuals, especially IDD individuals with comorbid behaviors. So it is very hard, but I think I know, Kathy, you said it at the very beginning that communication is very important in dealing with the providers, and I agree. I have learned through watching and through many other parents that you can't come in there all upset and yelling because no one is going to listen to you. It's a way of tuning you off because they can easily say, well, this person doesn't know what they're talking about. We can't make head with this person. And as hard as it is, because with our adult children, it is hard not to get emotional with all the things that they go through and all the things that we want to try to always continue fixing for them, advocating for them. But I've learned that it takes patience and respect, a calm voice that gets you places. It gets them at least to listen. But I'm learning a lot today. Thank you.
Thank you, Romy. My background comes out of the school system. I was a school administrator, and one of the things I say all the time is your job is to build a good working relationship as much as you can. And at times that's not possible. But by starting with clear expectations and working collaboratively, that does help. That doesn't solve all of these problems. And
Yeah.
as has been said before, there are many individuals in the system who don't have a family behind them. And, the procedures and policies that are in place need to be there to protect everyone, whether they have a family there advocating actively for them or not. So thank you. So, Kyoko, are we going to Pat?
Yes, next speaker is Pat, followed by Dottie Blakesley and Yana Mermel.
Okay, Pat.
Thank you, Kathy. Excellent points, as well as Romy and Melinda. I think, the lack of understanding of the disability community, especially those with the severe, is definitely a problem with the culture within these providers. And I think all of these metrics we've talked about, top-down leadership evaluations, training for the support coordinators, for the direct support professionals, for the managers, for the providers, in just what does this look like? How is this different? It's just right now it feels like anyone can become a provider, just do the paperwork, right? And then, there's, like Melinda said, I mean, first of all, thank you for doing what you're doing. I always said it's the siblings that are going to change the world, right? Because they get it. And when you get something, you come with it with a different perspective. It's one of caring, and it's one of trying to continue this fulfilling life that we've all worked so hard to, like, the education, everything we've done to hit 21 and feel like, there's no continuation of this, and we all should just accept substandard care because that's all we got, it's a very, saddening perspective. And so I think the time is now to change. And my background is in hospital administration, and so when you look at like what Mike was saying, when you look at nursing in a hospital, there's a change of staff huddle, there's a communication, there's a relationship there before people go on and off shift. There's proactive rounding. They're checking in with the family proactively. They're not waiting for something horrible to happen. We're viewed as a collaborative group. Like the culture here has to change because it makes everybody's life better. It is a win-win situation for the providers and for the families if we can sort of just change that culture to one of caring, to one of understanding, which pulls me into the 5-year plan. And if you go back and look at some of the goals that we had recommended from NCSA New Jersey, one of them was having an incentive to sort of build a specific blueprint for the severe acute population, right? If we can show 1 or 5 houses doing this correctly by leaning on those people who are doing it right, utilizing the funds in a way that makes sense, and that 80% or 70% are going to direct person who needs it, having supervision from a medical standpoint, from a behavioral standpoint, really making it happen and show, look, this can be done, will be golden, because then there's somewhere for all of us who have the severe and profound to, 1, rest in peace when our time comes, but 2, feel like there is a place in the community where they can thrive, not just survive.
Thank you, Pat. Well said.
Yeah.
I think we're going to Dottie.
Yeah. One of the things that used to happen before fee for service, where providers would do their own inspections of their houses. But now that inspections are mandated by the state and it's a very prescribed inspection, what houses are doing now is, because what usually happens is licensing or OPIA will say, these are the 2 people that we're going to review, inspect. So they'll just set everything up so they'll pass inspection for those 2 people. And what I think would be really good is if we had a best practice for providers to actually do their own inspection. So it would be a little bit broader, not so formal, not come with necessarily, a black mark from the state. That's all.
Okay, thank you. We're going to Yarmel.
I have Yana Marmel here.
I'm sorry.
Hi again. So I feel like, and I know NJCDD and Paul and Dottie are gathering all of this feedback, but I almost feel like maybe this is just a recommendation. Maybe we need to have a Google Docs going where all of these suggestions are captured and it's ongoing. Where I don't know, I'm not on Zoom. I'm dialing in via audio. Actually, I'm calling Mercedes, and Mercedes is calling me right now. So I don't exactly know how many people have dialed in. But like, despite how valuable all of these comments are, the effect of to the wire is still there. So I feel like it would be so valuable in capturing, if we could just have a document going, a live document where we could input our feedback and make suggestions, and then ultimately somebody, whoever will be in charge, and JCDD, Paul or the new ombudsman could somehow be the conduit to getting this to the governor. I think that would be a worthwhile exercise. What do you think?
I think that's to some degree what we're hoping to do. Kyoko or Mercedes, correct me if I'm wrong, that all of these comments today will be captured and sent. I mean, what we do plan to do is, as many of you have said, there's been repetitive comments, which only goes to the importance of them. So we will bring it together so that those comments are all collaborated and put together. But the idea is that the feedback today is going to be sent out to everyone, and your comments then again on that document will be very important. Correct me if I'm wrong.
No, we do. I think to Yana's point, something that's living and breathing and accessible at any point in time. We have about 80 so or more
Yeah.
people that have been participating so far today, and there could be different people, coming in and out.
Correct.
We can at the council we can look at the way to have something live in a space that people can access. Not everyone has access to every type of platform out there, but we can explore and investigate, what we can do to make something more readily available. We do maintain the survey document. It's still an open document that people can use to send in additional comments. Yana, you said you used it last night, so we know it's working. And we'll maintain that, but let's explore. We'll talk after this meeting today and explore the possibilities of something that you're describing, Yana.
Sounds great. Thank you so much.
Okay, you're welcome.
Okay, Kyoko.
Kathy Freeman.
Okay, Kathy.
I just want to say what I said in the chat. Really, agencies often have knowledgeable and highly paid professionals on staff who are publishing articles and presenting across the country about person-centered care and many of the things we're talking about today. Really great things. And also the Bog Centers has some fabulous resources and trainings. But rarely are these practices actually being done at the bottom where our loved ones are. It isn't being done in their own agencies. There's no integration of the knowledge at the top and the clinical skills to the bottom. They're not the ones doing the trainings. They're not the ones who actually get in the homes and actually help these DSPs. There's no accountability to ensure good practice. We don't have to reinvent the wheel. I keep hearing, what are good practices? You have people in these agencies that know what the good practices are. They read the journals, they're doing the research. Just require and enforce these practices are being implemented and the outcomes that are measured. As an example, somehow CHOP, as we all know in the South Jersey area and really across the country, is able to build its reputation because they actually do what they preach. So really, I really think that, we have talent out there and it's well paid. But what we're also seeing at the bottom is we see these low pays, and I'm not saying pay is the whole answer, because I see managers who are rarely in the group home, who have another job, full-time job, and I've been told that they're there when they need to be. But I also know staff go out to pick up takeout. Staff go to get lottery tickets, especially when the Powerball was real high, because when you live in the area, you do see these things. You recognize your own staff. So honestly, the administration needs to get in the homes. They need to see it and they need to take responsibility and they need to make sure there is quality being done at the bottom. I also know with the adult population that the staff in some agencies aren't behaviorally trained the way they train in schools that IDA does provide the funding for. But when Paul talks about follow the money, and we have some fabulous professionals, and I know many of them who know a lot because I've been to Kozak/Autism New Jersey over 24 times. They're providing presentations and they're very, very good. But as a person whose loved one receives the services, I don't see it at the bottom. So we have good practices out there. We have knowledgeable people. We just have to enforce and make sure it's being done and that the money being spent is actually to the benefit of the individual that needs the services. Thanks.
Thank you, Kathy. Can I just highlight something I see in the chat? Because I think it's just worth bringing up. Someone put in there about having not seen the person-centered planning tool for several years. That should be looked at every year. And if you're not seeing that, you need to ask for that. Your support coordinator should be facilitating that along with the provider and definitely ask to see that because it should be a living document that changes as the needs of the individual change. Kyoko, do we have anybody else? I don't see a hand up at the moment.
Oh.
Oh, I see a hand. I see Vincent.
Hello?
Hi.
Yeah, thank you. I wanted to that I've seen lots of examples of DSPs and managers. They have two jobs, sometimes more than two jobs, just to make ends meet. And that results in them being tired. And then you see people sleeping during their shifts. You see they're irritable. They're making mistakes. And this is one of the things that can result in abuse and neglect, and that's because they're not making enough money. They're not making a living wage doing this job. I think that's a big problem. Thanks.
I think that's very well said. I think Victoria Sabrower would like to speak. Victoria?
Hi, can everyone hear me? I know that the gentleman who just spoke, I think mentioned this. I wanted to ask about an idea that I've had about a directory that parents and clients and people receiving these services create, where other people can look at and kind of assess the sorts of services that have been received. So it would be like all the types of things that my younger son, who is a completely average person, who's going to end up taking care of my older son when I pass on, uses for every single thing he consumes, from food to jobs to I don't know, any single thing he does. Young people are always looking to see how things are being assessed by the people who use these services. I just started getting therapy, and I immediately got something saying, "How did it go?" But the whole time my son was in a home, no one really said to me, "How's it going?" Or, do you want to like publish anything about the fact that he's in bed almost all the time when he's not at his day program, or the fact that he can't eat food when he wants to, or the fact that his clothes are filthy with grease because staff doesn't feel like trying to get stains out of his very stained clothing. I just, I hear Kathy's frustration, and mine is, I'm right there. But why don't we have a directory where I can, as the mother of a very challenged human being, can't like look at reviews of places and agencies where where I might want to look for housing for him. It doesn't seem like that would be difficult. I've talked to other people about it. Why does this exist? Maybe it exists. Maybe I can go and say the Arc of Middlesex and see all of the bad reviews that I should have seen before I put him in the home, where I was being threatened with not being able to come in anymore because I was the only family showing up for my son, the only family. And when I asked about other families, I was told, we can't talk to you about that. I mean, we have to do this again. I cannot live forever for my son. So this is his future, but it's scary to feel like I'm just going to do the exact same thing that I just did for 9 months, putting him somewhere where all the things that people have been talking about so politely and so nicely, it's basically, I mean, I am told now it's never going to be perfect. You're going to have to accept a lot of these things. And maybe if there were a directory where, people can publish, independently, watch out for this. This is because after we placed my son here, the support coordinator said to me, yeah, I hear a lot of negative comments about the agency that you placed your son with. I went to a Christmas party and another mother came up to me and said, are you kidding me? You put Sammy there? I used to work for them. I almost fainted on the dance floor. I mean, but like, how come this information isn't out there? We all know the situation. We all know what has to be done. Yeah, people need to get paid more. That's right. Everyone needs to get paid more. Is that ever going to happen in my lifetime? I don't know. I would support that. But I really have to worry about things like, where am I going to put my son, and can't I, why can't I know where I'm going to put him before I start this whole process again? So that was my idea. Like, can we have a consumer affairs directory of, you know, homes for people with the kinds of needs that my son has? I don't know.
So informally, Kathy, if I could just respond quickly. Informally, there are places. There's one in the chat that Patricia Miller put in on the New Jersey chapter of National Councils on Severe Autism. They have a review chat for families when they like an organization. Also, there's a Facebook group called the New Jersey Parents of Developmentally Disabled Adults.
I hate Facebook, so I don't use Facebook. I'm talking about,
Okay. So
yeah, yeah.
maybe someone else in your family does that. They often will share feedback on agencies where individuals and families can report, what they're happy about, ratings and scales. So there's a couple of different informal, I'll call them, less formal across the board that everyone can access. And then there's that report card. I'm not sure if you were here earlier in the state
Yeah, I
agency
know about
government.
that from, yeah, that's a
Um,
state. I'm talking about, like, um, people, power to the people kind
right,
of thing.
right.
I
Yeah,
don't
I
mean,
mean, yeah,
I mean,
yeah.
because I hear a
We
lot
hear
of,
you.
I
We
mean,
hear
I'm
you.
getting told that I have to watch myself. And I mean, for 9 months, I supported the people working there. I got told by the manager that she wanted to put in my son's IEP that I cannot ask the support people anything about themselves. Like, I would have like nice conversations with some of the DSPs about where they came from and their situation in life, because I like people and I wanted to get to know them. And the way that was dealt with was, we're going to put it in your son's IEP that you cannot ask people questions. It's like, okay, they live with my son. This is my first child. Okay, I have, I'm doing it because I'm interested in them and because I consider them family at this point. So what I really mean is, like, I mean, we have all of this going on. We have all these beautiful things typed out and everything, but, you know, like Kathy said, does it like change anything really on the ground if you're a person with getting these services? And I can go to Yelp and find a hairdresser, for God's sake. I can find somebody who, lots of people like how they cut their hair, but I can't, go easily and find, something solid like, this agency will intimidate you and find fault in you being upset because every other entity that's dealing with your son is complaining about how he looks every day. That sort of thing, like in writing, someplace easy to find, 5 stars, 1 star. You know what I'm saying? I'm not saying like complicated or Facebook families, or I just really mean like, gosh darn it, these are services that are being paid for, and we're treating them like we're supposed to be diplomats that know how to deal with every sensitive situation so that our loved one is not being ill cared for. I'm sorry to be so upset, but I just think that we as consumers, educated consumers and family members need to have more, input and more serious. And another thing I want to say about uh, how difficult it is to find spaces for our people, it used to be much more difficult. So I think the state giving monies to families to take care of their kids has alleviated a lot of that. So um, again, like, to be afraid that this is the only thing for my son. I know when we put him in this home in October 21st, 2023, no one else wanted to be in. I mean, it took them a year and a half to get two people to live in this four people home, and the home was absolutely gorgeous. So, and the support coordinator at the time said, nobody wants to be in these homes. So I wanted to talk about that too. I don't know where everyone lives, but I live in a very, very congested area of New Jersey, and the competition for placement is not what it once was. I just wanted to say that too. But yeah, if anyone's interested in doing that, they can get a hold of me. I would be interested in doing a directory of, that really rates, you know, this sort of service, like, you know, granularly, like, in detail.
Thank you,
Thank
Victoria. I think there's a lot of support for what you're saying in the chat. I'm just reading some of the comments. So I think, that's something will definitely be part of the feedback that comes back from this event today. We are at 12:09, so we're 4 minutes over. I just want to say thank you to everybody for your thoughtful, really important comments. And, this is a conversation that will continue after today and also after lunch. So thank you.
So you can keep your computer on and stay in the Zoom room here, just go off camera, or you can leave completely and then just use your link to come back in. And at 12:35, we will start on the topic of frontline staff.